Hypertrophic cardiomyopathy is a commonly inherited autosomal dominant disorder. You have to memorize it's autosomal dominant. Some of the cases are sporadic. The most common cause, this is the most common cause of death in young people and in athletes, and that is really important for exam. Hypertrophic cardiomyopathy. So this causes left ventricular hypertrophy. So therefore you have impaired diastolic filling. The patient will present with dyspnea, shortness of breath. That's the most common symptoms. There could be chest pain, palpitation, and syncope. On ECG, there's lots of things being shown there. You cannot really memorize and say, oh, this is the one for the exam. So you can have right axis or left axis deviation, conduction abnormalities, sinus bradycardia, ST wave changes, T wave inversion. You can have bradycardia with ectopic atrial rhythm, atrial enlargement. You can have atrial fibrillation. That's the most common sustained arrhythmia. So all of these things, you can't really memorize them and say, oh, this is going to be hypertrophic cardiomyopathy. So what's really important is going to be the bottom one here, that they're going to have a forceful apex beat. And they tend to give this in the exam as well, having a forceful apex beat or having a double impulse if the ventricular outflow is obstructed, or they're having a murmur, a late ejection systolic murmur. So even with that, you can't in the exam you can't really diagnose. You have to have few things. The most important thing is that it's going to be a young person or an athlete, and then them having shortness of like dyspnea, chest pain. They're going to have some ECG changes, and you may get like they might tell you there's a forceful apex beat or there is a ejection systolic murmur. If they have given you enough information, the diagnostic test is transthoracic echocardiogram. And also, it's very important that there's other causes that we need to exclude. So the patient may need to have endomyocardial biopsy to exclude other causes of the thickness of the wall being thick, like amyloid.